In the 1970s and 80s, most of adolescent Australia learnt about sex and sexuality from the doctor who wrote a column for Dolly magazine, Dr. Dolly. Well, in this podcast you meet Dr. Sue, one of Family Planning Tasmania's wonderful team of GPs. Here Dr. Sue and I talk about the things that can cause painful sex, vaginismus, vulvodynia, or just not being into it. Sue, could you give us a definition of vaginismus and vulvodynia? What are these things?
Oh, they're tricky things to try and define. Vaginismus is really painful sex caused by spasm of the pelvic floor muscle. So you know how we've got the pelvic floor that holds everything in, and like any muscle, if there is tension, then that muscle tightens up. And so if somebody's had painful sex or that they don't want to have sex, that muscle tightens up in anticipation of that, and that is what vaginismus is. That is kind of anticipatory, that muscle's tightening up because it doesn't want your body to experience more pain, and the more that happens, obviously that becomes a vicious circle and the worse it gets. Vulvodynia is more of a kind of global term of pelvic pain, and it doesn't necessarily have to be associated with sex.
Okay. And what proportion of women are affected by these things?
Around about 1 in 5 women have pelvic pain. That's not all vulvodynia and vaginismus, so period pain, bowel-related pelvic pain, bladder-related pelvic pain. Really difficult to get good numbers on what the incidence of vaginismus is and vulvodynia because it's such a fluctuating thing, and most women, if you ask them, would have experienced painful sex at some time in their life.
But there's another reason, isn't there, why women have painful sex, which I don't think we've covered so much, which is actually a lack of arousal.
Yeah. And actually libido too. I don't know if I can tell you my funny story that I went to a really boring lecture once on libido, and it was talking about the difference between libido and arousal in men and women, and it was saying that for women it's a bit like cooking this really complicated dessert, and you need to have all of the ingredients and the scales and the oven at the right temperature, and then when it all comes together it's the most wonderful creation. But for men it's a bit like a packet of shake and bake pancake mixture. But I think the point it's making is that libido and arousal is really, there are lots of things going on for women that affects it, all of that, how they feel about themselves, how they feel about their relationship, whether they're tired or not, what their hormone levels are like, whether they're breastfeeding. A whole heap of things are going to impact on, one, a woman's interest in sex, and two, whether she's aroused or not when she's having sex. Women have sex for a whole heap of different reasons. We tend to think that the only reason that people have sex is because they want to have sex. Sometimes it's a job that they have to do in order to make the rest of the day work properly, and if somebody's not really into it, why on earth are they going to feel aroused about it? And then it becomes painful, and then the situation just gets worse.
So what is the level of training and awareness like among GPs about?
Most GPs have an area that they're particularly interested in, and I think if you're interested in it, then you tend to know more about it, and you tend to have a more helpful response to people coming in. I think for a lot of GPs, they don't feel like they've got really good skills with that, and often it's better not to ask, because then you haven't got to deal with something that you're not quite sure that you know how to deal with. So
it sounds like on this topic, as and others, keep asking for the help you need.
Yeah, and a lot of women are. There's often a really sort of private, lonely place because we think that nobody else is experiencing that. We don't go around talking about discharges or pain or arousal, and so a lot of women feel like they're the only person experiencing it, and there's something that they're doing that's wrong, and there's usually lots of things that are impacting on it, and actually starting that conversation is an incredibly brave thing for a woman to do. It's a very vulnerable position for a woman to open up about it, but it's such a good thing if you can move forward and get the help that you need to improve the situation.
And we're really hoping that this podcast will help. It's a way of getting information and
Absolutely.
maybe the first step towards having a conversation with someone about your experiences.
Yeah. And I would just say, if you are in that situation and you go and talk to somebody and you don't feel that you've got the answers that you need, go and talk to somebody else. That is not your problem, that is the person who's listening's problem, and you need to get the help that you deserve to help get the treatment that you need.
So what's the recommended treatment for these conditions?
Well, a lot of it depends on what's driving the condition in the first place. So, if it's a purely physical problem, then maybe just dealing with that physical problem. So maybe if it started off with a thrush infection, making sure that thrush infection gets treated properly, or if it's a menopausal vaginal dryness issue, treating that symptom. But often it becomes part of a bigger picture, and so really, really important to think about what else is impacting on this and how can we move forward with it. So the posh name for it is a multidisciplinary approach to it. So you want somebody who is interested and capable of treating anything that needs to be treated medically. You might need to see a psychologist to get some help with it, because we know that if you've got something painful, then it's going to impact psychosocially and the other way around. And your pelvic floor physios are absolutely crucial to this, to try and help to retrain the pelvic floor. And it's like any muscle, it can be retrained. That's the really good thing about this, is that women aren't stuck with this all their life. That's not their burden to carry. We can help. It's about making sure that you've got the people around you who can support you with that.
Yeah, this actually has been a lovely, positive podcast. So, such a heavy burden, but there are answers.
Yeah, and I actually think that's a really good point, Jo, because you can often see a lightness when you talk to somebody about it, because people do carry that really. It's almost like this shameful secret that people have that they don't feel that they can talk to, and just to know, that there are other people and that there is support. I'd be lying if I said it was a really quick response. It takes often quite a bit of time, because these things don't happen quickly, and so also the solutions don't happen quickly, but people can get significant improvement in their symptoms with it. But I would make sure that you go and see somebody who can listen really carefully to what's going on for you, and to have a little bit of a plan about the way forward.
So you're like an athlete coming back from a sporting injury. You have to put the work in.
Absolutely.
To rehabilitate.
Absolutely. Yeah.
So is this something people can come to family planning about?
Yes. We actually see a lot of women with pelvic pain or women's health issues. The doctors who work there are usually like myself, they're GPs, but they've got a special interest in women's health, and they've often done extra training in that area, and we tend to have longer appointments so that we can give people the time that they need to try and help move things. And we've often got really good relationships with specialist pelvic floor physios and psychologists who've got an interest in sorts of women's health issues. So yes, that's the short answer.
Thanks, Sue.